deadly psychiatric illnesses are not what you think. It's definitely not schizophrenia, and it's not depression, okay? It's actually eating disorders. Binge eating disorders, which I'm sure you are guilty of, and the more rarer anorexia nervosa I've seen Charlie from Heartstopper. In today's video, we're going to be talking about these psychiatric or mental conditions and how we in the medical field try to resolve them as best as possible. I mean, you can't just force someone to eat food just because they're anorexic.
How is it? Is it good?
Or tell someone to starve because they're bulimic, or tell someone not to watch movies because they're binge eating. So, hey, stick around, let's find out. First, let's actually define what these conditions are. To begin, what is anorexia nervosa? Well, anorexia nervosa is a condition which is essentially characterized by intense intentional starvation, as we've seen, of course, Charlie from Heartstopper. People who have this condition tend to deliberately starve themselves of food for a prolonged period of times. By prolonged, it could be as much as 2 days, a day. I wouldn't say a week because I don't think, but it is practically possible. And they do this because they have this distorted body image of themselves. That's why it's a mental condition, by the way, where they feel like eating will give them obesity and make them overweight, and because they're trying to keep their body, so to speak, fit, they starve themselves intentionally. Now, what about bulimia? Bulimia is kind of a worse off condition in the sense that patients that have bulimia usually show up with this intense cycle of binging food. They eat food, rather binge eating food. They eat so much within a short period of time. Let me, for example, you're watching a movie, you just get carried away, and you just want to eat all the chips in the house, and you finish it and just go eating non-stop, and it's almost uncontrollable. Like, this food is just helping you watch the movie more, and you keep watching and you keep eating, and it's great, and the movie ends and you realize you've eaten, like, for exaggerated purposes now, 100 bags of chips, for example. Such can be characterized as bulimia during the bulimic phase, but the problem with this is that after eating so much, you feel bloated and you feel bad. And it's not necessarily just because you're feeling like you're gonna get obese and all that, but you just feel necessarily depressed and bad about it. And obviously, because you have a distorted body image already, now goes the purging phase. Now, the purging phase of bulimia, the person usually presents with this intense desire to lose the weight from all the food. Usually it's an acute condition, so probably they will take laxatives, or like Emma from Gen V, they instigate vomiting by trying to retch themselves out. And it's not really a very comfortable thing. It's actually quite disgusting, but yeah, people go through it. Now, what about binge eating? Now, I know lots of you want to know this, but binge eating is essentially, it's a mental condition, yes, but it's more similar to bulimia, at least during the bulimic phase. The person is actually actively eating uncontrollably within a short period of time. As you said, or as I said, you're watching movies, you're eating so much, so rapidly, and it seems great and it seems alright. But the good thing about it that differentiates it from bulimia is that there's no purging phase. So while the person may still feel a bit depressed when the movie ends, for example, when the chips are over, when the ice cream is out, when the cake is on and everything else is gone, they don't try to retch themselves out. They don't try to vomit. They don't try to eat laxatives to try to lose the weight. They just are sat in the depression, in the bad feeling of being obese or growing overweight. But in binge eating, the depression is not necessarily as a result of like a distorted body image where they feel, oh, I'm going to get fat. It is not necessarily that. Okay, so that's one big difference between it and bulimia. Let's go. Bulimia already defined as well as all other eating disorders. What is it that makes them so bad, so to speak? I mean, obviously, apart from the obvious effect of weight loss or weight gain, which is evident to the physical eye, the more scary part is what is called refeeding syndrome. Refeeding syndrome, and it's not very common. I mean, except like you're anorexic, but it presents like, say, where if you watch the series Heartstopper, great show, obviously. The I think in season 1 or 2, Charlie had a syncope, or he fainted after he hadn't eaten for a couple of days, and yeah, in such a case, or way worse than that, for example, if the patient presents to the hospital and we find that, or doctors, because I'm still going to be a doctor, doctors find that the patient is severely malnourished, and they try to give the nutrients parenterally, maybe through IV. The problem is that giving glucose this way may cause a significant increase in insulin. Obviously, it may not be as much as if it was given orally, but it is enough to cause the potassium that is already in the cell to increase, such that the potassium in the ECF moves into the cell. Okay, this is like me gabbing if you don't understand, but essentially insulin causes the potassium in your fluids, in your bodily fluids, in your blood, for example, to move into your red blood cells. Now, if this happens, there will be cardiac arrhythmia. So the person may start having like heart beating problems. They may actually die. It is actually possible. So what is done is that usually you do it slowly. You do slow infusion of parenteral nutrition, because you don't want to cause these things. And obviously, from the refeeding syndrome, away from it now, it is very difficult to manage eating disorders. I say difficult because it's not like a virus. Oh, you want to give a vaccine. It's not like a bite. Oh, you want to treat the wound. It's a bit more. It's a mental condition, and like most mental conditions, the treatment for it is a multi-step process. Now, for most of these conditions, like binge eating disorders, I wouldn't necessarily say anybody really significantly cares, but if you decide to go for treatment, maybe you're having to suffer from like bulimia or anorexia nervosa, as in Charlie's case from Heartstopper. I'm sorry I keep referencing Heartstopper, but if you haven't watched it, you probably should. But if you do decide to present with such, or if you do present with such an extreme case of it, what we can do, or what is the treatment modality, is that first off, you want to be started on like eating disorder focused behavioral therapy with a specialist therapist. You want to get that as much as possible to see what the problem is. And after therapy, you are also going to be, even while in therapy, not after, you're still going to be coached by a dietitian to try to help you with your feeding habits, with the food you should eat, to try to re-nourish you. And that's just 2 steps. The other steps, I guess modalities are varying. I'd say varying because different places have their different ways of managing certain things. But yeah, those are the 2 essential steps that must be in it. And that said, I think that people who are having conditions like this, they don't even realize it themselves, because most of us, the world has lots of problems, and we have lots of problems, and we don't even see. It's food. It's like, oh, some would just say they have an unhealthy relationship with food, and that is very correct. But I believe that if you feel you're bulimic or you're anorexic, you should seek help. It's not a good thing to have a mental image of yourself that is distorted, that is not good. We obviously all look at the mirror on the camera and be like, oh, the popular meme. The camera is looking ugly and the mirror is looking pretty, but it is a completely different scenario when you always see yourself in a bad light. And going to seek mental help does not make you weak, it doesn't make you sick, it just makes you going better. And getting a better quality of life should not make you feel any way but positive, okay? Now, it's important to note that managing conditions like bulimia or anorexia, or even binge eating disorders, if you have them, for most of us that do, okay, I don't binge eat anymore. I used to when I was like maybe 14, 15, because I didn't necessarily have, I had a lot of friends growing up, obviously, but when I got to my teenage years, I found that most of my friends were not really friends. I was the only one who was really caring enough to do anything for them, for their birthdays, for their parties. I'd always show up, give gifts, and I wasn't even working. So this was like my money for my mom, and I just go and buy stuff. Instead of buying for myself, buy for someone else who I cared about, and I wanted them to know that I cared. But these people, when it was my birthdays, when it was my parties, they did not appreciate me and such. So I really kind of cut people off and just, segregate myself from the population, so to speak. And that was, for me, that was my own cause of binge eating disorder. So movies became like my own outlet. I don't know what yours is, but you can always help yourself try to figure out why you started it and how it started. But eating disorders and managing them is a thing that requires patience, and you should be patient because, like most mental conditions, it doesn't really resolve just because you go for a first therapy session or you see a dietitian. It's a conscious thing, and you have to keep telling yourself, okay, I've eaten enough for today, that's enough, like I don't have to eat too much, it's okay. And reassuring yourself, goes a long way, because obviously no matter how much therapy you get or how much dietitian advice or requirements or whatever else you feel, it boils down to your decision to eat or not eat, to control your diet, to control your feeding habits. Okay? So please be kinder with people, be more patient with people. We're all going through old stuff. And yeah, I'm doing my exams now. So toodles. Thank you for your prayers and thoughts. Bye.